Let's talk about one of the most common and misunderstood conditions we help people with every single day. That's a condition called peripheral neuropathy. Peripheral neuropathy happens when the nerves in your feet, legs, and hands, or even arms become damaged. These nerves control sensation, strength, balance, and even some of the automatic functions in your body. So when these nerves become damaged, people often experience burning, tingling, numbness, sharp pains, or even difficulty walking. Now, a lot of people are told that's just part of getting older, but that's simply not true. Neuropathy always has a cause, and when we identify the cause and treat it properly, nerves can often heal. Now, in our practice, there are three major causes of neuropathy that we've seen over and over again over the past 20 years of being in practice. The first major cause is type 2 diabetes. And when blood sugar remains elevated for long periods of time, it damages the small vessels that bring oxygen and nutrients to the nerves, and those vessels deteriorate and nerves essentially become starved. This leads to degeneration, numbness, burning, tingling, and even a loss of sensation. Patients usually describe it as like walking on pillows, or they'll feel like they have ants crawling on them. Sometimes they feel like their socks are bunched up, but their socks are fine. Or they're feeling like they're stepping on rocks even when the floor is smooth. The earlier you intervene in this process, the better the chances for nerve recovery. Now, the second major cause is the use of statin medications. Statins lower cholesterol, of course, but they also reduce levels of an essential nutrient called CoQ10. CoQ10 is what your mitochondria, which are your cell's power plants, use to make energy. And nerves are some of the most energy-demanding cells in your entire body. When that energy production drops, nerves start to misfire. That's when people begin experiencing tingling, burning, weakness, or muscle cramping. We see this all the time, and when we support the body appropriately and replenish what's missing, patients often notice a significant difference. And the third major cause is degenerative disc disease, or a condition called spinal stenosis. Neuropathy does not always start in the feet, and that's why sometimes we need to look at the spine. When the discs between the vertebrae wear down, or when the spinal canal narrows, it can compress the nerves as they exit the spine. That compression interferes with the nerve signal traveling down the legs and into the feet, and this is when patients might experience sciatica, shooting pain, numbness, tingling, or weakness. If that compression goes untreated long enough, it can lead to neuropathy-like symptoms even when people don't have diabetes or take statin drugs. Now, the good news is that we take a very comprehensive, regenerative approach to helping people restore nerve function. So patients with spinal issues, we often use decompression therapy. This gently stretches the spine, it reduces pressure on compressed nerves, improves disc hydration, and restores the space to those nerves that need to function properly. Over time, this can reduce inflammation and dramatically improve nerve signaling. We also use something called human cell tissue therapy. This treatment introduces regenerative biological components that help reduce inflammation, promote healing at the cellular level, and support the repair or damaged tissue, including nerve structures. We also use something called A2M injections. A2M is naturally occurring in your body, and it binds and neutralizes destructive inflammatory enzymes in the body. By reducing those enzymes, you can protect the nerves, the joints, and create a healthier environment for those tissues to heal. We frequently incorporate things like shockwave therapy. Shockwave treatment stimulates cellular repair, regeneration, increases circulation to the treated area, and helps break down scar tissue that might be interfering with nerve function. Patients often report improvements in sensation and reductions in pain as the sessions progress. Infrared light therapy is another important component of our neuropathy program. This type of therapy boosts nitric oxide production, it improves nerve metabolism, and supports the healing environment that nerves need to degenerate. It's very gentle, it's relaxing, and it's very effective when done consistently. And then we tie everything together through functional medicine. So we look at what's happening internally with things like blood sugar stability, nutrient deficiencies, thyroid health, inflammation, and even interactions with medication. All of these factors can contribute to nerve damage and slow down the healing process. When we correct the underlying issues, this gives the nerves the best possible chance to repair. Now, here's the best part, and I want you to hear this. Peripheral neuropathy rarely improves on its own. And medications like gabapentin or Lyrica don't actually heal the nerves, they just mask the symptoms. So if you want long-term improvement, we need to treat the root causes and support actual nerve regeneration. And that's what our neuropathy program is designed to do. If you're ready for real answers, not more prescriptions, we're here to help you restore your nerve function and reclaim your quality of life. Visit www.growwithvitality.com or call 951-225-4419 to secure your appointment.